Hi, this is Deepak. You're watching Simcoe Community Media. Behind me is the location of Barrie's proposed safe consumption site, which has been waiting for a green light from the Ford government for the past 28 months to become fully operational. Yesterday, the Canadian Drug Policy Coalition, in partnership with a coalition of 51 groups, demanded immediate approval of such pending sites in Ontario. To support their argument, a panel of experts, including medical doctors, shared the benefit of the site and grim statistics in its absence.
The overdose or toxic drug crisis has been building across the country for a decade. We lost over 40,000 people in Canada in the last 8 years. In Ontario, 7 to 10 people are killed every day by toxic unregulated drugs. As demonstrated recently in Belleville, there are also massive strains on emergency services and hospitals. Unfortunately, the federal government has not been bold enough in its actions, while some provincial governments have not supported the initiatives and policy changes needed to end the crisis. Specifically, despite the proven effectiveness of supervised consumption sites, the Ontario government has delayed and impeded approval and funding of sites under their consumption and treatment services model. Some applications have been waiting for over 2 years.
The coalition has put forward a total of 8 demands to the Ontario government.
As noted in our letter, we have several demands. The first being to immediately provide direct emergency funding before March 29th to sites that have submitted their applications and are under imminent threat of closure or have closed due to lack of funding.
Along with Barrie, at least 4 other submitted applications for the sites have been delayed by the Ontario government. These include Sudbury for 30 months, Windsor for 19 months, Timmins for 13 months, while Hamilton withdrew their application waiting for 2 years. The Canadian Drug Policy Coalition has called these delays unacceptable and deadly. Many prominent community leaders from Barrie have signed the letter authored by the Canadian Drug Policy Coalition. These include Alyssa Wright of Supervised Consumption Saves Life, Victoria Scott of Engage Barrie Organization, and Reverend Christine Nayler of Ryan's Hope. Nayler is also director of Simcoe Community Media. However, none of the board of directors have any editorial powers. We have reached out to the Canadian Drug Policy Coalition to understand the potential impact of the delay on Barrie and Simcoe County and will bring you updates in the future. Below is the video of the briefing.
Hello, thank you for coming. I'm Nick Boyce with the Canadian Drug Policy Coalition. Please note we are recording this briefing. Today, we've brought together groups from across Ontario whose communities have been affected by provincial delays and barriers to life-saving supervised consumption sites. I will share some context and policy perspective, then pass to our panelists for brief remarks. We will then have time for media questions. If you are media, please change your screen name to identify the outlet you are with and add the number 1 to the beginning of your name so we can prioritize your questions. The overdose or toxic drug crisis has been building across the country for a decade. We lost over 40,000 people in Canada in the last 8 years. In Ontario, 7 to 10 people are killed every day by toxic unregulated drugs. As demonstrated recently in Belleville, there are also massive strains on emergency services and hospitals. Unfortunately, the federal government has not been bold enough in its actions, while some provincial governments have not supported the initiatives and policy changes needed to end the crisis. Specifically, despite the proven effectiveness of supervised consumption sites, the Ontario government has delayed and impeded approval and funding of sites under their consumption and treatment services model. Some applications have been waiting for over 2 years. Yesterday, a coalition of 51 groups endorsed a letter to the Ontario government demanding 8 urgent actions. A link to that letter is in the chat. As demonstrated by the overwhelming interest in today's event, almost 500 people registered in just a few days, it is clear people across Ontario care deeply about this issue. Right now, there is an opportunity for all levels of government to urgently get on side and take action. The evidence is clear. Supervised consumption sites stop deaths, reduce costs and strains on emergency services and hospitals, and increase connections to health and social supports, including treatment. The first sites in Ontario opened in fall 2017. In June 2018, the current provincial government was elected. Since then, the unregulated drug supply has become increasingly volatile, but instead of scaling up sites, the government added a layer of red tape to the application and reporting process, put an arbitrary cap of 21 sites across the entire province and is currently only funding 17 sites, with only one in Northern Ontario, where they have some of the highest death rates in the country. Other sites have had to rely on temporary municipal funding and public donations, despite this being a provincial jurisdiction. Windsor recently closed. Without immediate provincial funding, Sudbury and Timmins will close by the end of March. People will continue to die and communities will needlessly suffer if the Ontario government does not take accountability and act right now. As noted in our letter, we have several demands. The first being to immediately provide direct emergency funding before March 29th to sites that have submitted their applications and are under imminent threat of closure or have closed due to lack of funding. We will now hear from representatives of affected communities before media ask questions. Unfortunately, this issue has become polarized due to misinformation and political rhetoric. Please keep comments and questions respectful and as brief as possible. I'll now turn it over to Michael Parkinson from the Drug Strategy Network of Ontario. Michael.
Thank you, Nick, and thank you to all of you who are joining us here today, especially those among us who have lost friends and family far too soon. To have hundreds of people and organizations join us on such short notice ought to reassure all of us that there is widespread support to suspend the inertia and partisanship that divides us from the relief we all seek. The Drug Strategy Network of Ontario is unique in North America, stretching across urban, rural, and remote Ontario. Members and their partners assist in local, collaborative, and multi-sectoral drug strategies and have experience and expertise in advancing initiatives in prevention, harm reduction, treatment, and enforcement justice systems. And lest we forget, the coroner's fatality data reminds all of us of the opportunities to act on behalf of the dead, to protect the living, whether people are recreational consumers or are self-managing withdrawal or pain via unregulated, untaxed, and toxic drug markets favored by successive governments since 1908. By any metric, Ontario's drug poisoning tragedy meets the definition of a raging public health emergency. In the absence of deploying an emergency response, thousands of preventable deaths and injuries will occur this year. It is not a question of whether communities are overwhelmed. We are, and not just recently. Several Ontario municipalities and band councils have declared states of emergencies. Many more others are in a near constant state of issuing overdose alerts. Supervised consumption services are among the immediate life-saving opportunities before us, grounded in evidence and desperately desired by many Ontario communities. The network supports their expansion. At their core, the service is about a small room with a table, a chair, and a pair of eyes able to respond to a life-threatening emergency. That's not the complicated part. The complicated part is the expensive, arbitrary, and onerous approval process mired in provincial red tape that obstructs, dissuades, and divides communities. Having worked inside a consumption service and witnessed a plethora of benefits, I can assure you a table, a chair, and a pair of eyes should not be so challenging to establish and maintain. That service was later closed, and within 3 months, 3 people I knew had passed away prematurely. The Drug Strategy Network of Ontario strongly encourages the province to immediately seize the opportunities to expedite existing CTS applications, provide operational funding for non-CTS consumption sites, to end the ban on accommodating inhalation, the leading modality suspected at the time of death, and to redesign the approvals process to one that helps, not hinders, public health and safety across Ontario. On behalf of the Drug Strategy Network of Ontario, we look forward to the kind of leadership that swiftly embraces solution-focused evidence and the wisdom of caring communities across the province. Thank you.
Thank you, Michael. I'll now turn it over to Dr. Julie Sampson from Timmins and District Hospital. Julie.
Thank you, Nick. I'm Dr. Julie Sampson, and I'm one of the co-leads of the Addiction Medicine Consult Service in Timmins and District Hospital. Timmins, a population of 42,000 in Northern Ontario. Our hospital is also the operator of our safe consumption and treatment site called Safe Health Site Timmins, for which I am the medical co-director. Our consumption site is an integral component of our regional public health and harm strategy and serves as an access point for treatment services. This site's been operational due to funding from the City of Timmins until December 2023, with a temporary extension until the end of March approved by the Board of Directors of our hospital in the hope of bridging services until provincial funding approval. The Board of Directors of our hospital, City Councillors, and our community recognize the importance of this site as part of the continuum of care for our patients. Unfortunately, without provincial funding, our site will close March 31st, and it will be devastating. The risks associated with the closure of this site are significant and have the potential to negatively impact our entire community. There will be an increase in death. Our site has managed 361 overdoses since its opening. 36% required administration of naloxone, which could have resulted in fatalities otherwise if these clients were not using our site, with 0 fatalities from overdoses at our site. We can expect an increase in emergency medical service calls. This will result in an increased response time to other non-drug related emergencies in our community. Our site has helped reduce calls to paramedics by almost 20% for drug-related overdoses. We can expect an increase in presentations to our emergency department due to an increase in opiate-related fatal and non-fatal overdoses and drug use complications. This will contribute to increase in wait times in an already overburdened emergency department. We've been providing basic medical care to close to 150 clients, helping divert these services from the emergency department since our opening. We've been giving out harm reduction supplies to over 1,500 individuals and distributed over 220 naloxone kits per month since its opening. We will no longer be able to provide these. Our site is also unique as it is operated by our hospital and works closely with our addiction team. This has led to 40 direct admissions to our withdrawal management and treatment unit located at our hospital, allowing immediate access to treatment services. Northern Ontario has been disproportionately affected by opiate poisoning fatalities, and we still do not have a provincially funded safe consumption site in our northeastern Ontario region. This speaks to the inequalities and disparity of services within our province. In closing, we have a treatment center that has been proven to save lives and link people to healthcare services, social services, and addiction treatment. Why do we as a society continue to choose to ignore the evidence base and base our decision on public opinion? That continues to surprise me as a physician who's been trained to save lives and help people suffering from disease and illness, including addictions. Everyone's life is worth saving. We do not get to choose whose life we get to save. I ask the provincial government, why do you?
Thank you, Julie. We'll now go to Michael Brennan from Positive Pathways in Windsor. Hi, Michael.
Hi. Thank you, Nick. And I quickly would like to acknowledge everyone who gathered here today who continues to keep the dialogue moving forward on how we support our local and regional communities that we work with and for every day on this issue. And this is why I'm here today supporting this advocacy movement, is because of community, our community. The closure of our urgent public health needs site in Windsor, Safe Point, with the operating partners of Hotel Dieu Grace Hospital and Windsor Essex County Health Unit, is at a critical moment in time in our community, as we are now entering our 17th month since our CTS application submission. This government has committed to multiple sites in the province of Ontario, and we have followed an intensive, stringent application process as a result of this commitment. Since the critical incident in Toronto, attempts from our community applicants to understand what else will be required, timelines, guidance, or direction have yet to be communicated. There has been a tremendous expectation of transparency and accountability on the community applicants and stakeholders' end, and we would just like to see this reciprocated. A comprehensive response to reducing harms associated with substance use requires as many tools in our toolbox that we can access, which would be inclusive of a CTS. Our CTS application has been in a 7-year journey of consensus and capacity building with a broad range of community stakeholders from multiple sectors, a regional 4-pillar substance strategy, mental health and addictions networks, health and social support teams, the business community, residents, and lived experience of people who use substances. Our doors opened in April of this year, and slowly and steadily we began the process of building trust and meaningful engagement with a community that is often marginalized, stigmatized, and may sometimes require complex care and support. Just as we were about to gain traction in our community, we had still not heard from the government outside of them having to put a review process in place And we only had a finite amount of funding that was already generously put forward from our SafePoint partners that ended up impacting even their budgeting and programs. A tremendous amount of time and resources, both capital and human, have been invested at the community level for our SafePoint site. All of this, also through the height of the pandemic, this commitment of time and resources was a requirement by the province to support wraparound care and to build pathways into our community. We will have to restart that process, and that may require restaffing, training, onboarding, reestablishing community network pathways to community supports, and most important, rebuilding that trust that we had started to establish with the service users. In other words, this massive local investment in time and resources and development of care pathways will be difficult to maintain without provincial investment. Our local climbing statistics of overdose increases, toxic substances in the community, resulting in increases in emergency room visits, EMT dispatch, and enforcement calls continue to strain capacity in healthcare, and the social supports landscape is continuously challenged and changing beneath our feet in real time in our region. Finally, the province and our healthcare systems continue to send messages to the community level that there needs to be greater collaboration amongst service providers to work together to reduce barriers to access care, create pathways and continuums of care for treatment and support, improving patient navigation, and improving the health outcomes, to name but a few. The CTS process has been a shining example of how our community service providers have stepped into this space to address harms related to substance use in our community. All we are asking for is some transparency on the provincial side and to support the tremendous investment that has already taken place. Collaboration must have action items or it merely becomes another buzzword. Thank you.
Thank you, Michael. And I'll turn it over to Amber Fritz from Rezo Access in Sudbury, and then we'll have media questions. Amber.
Thanks, Nick, and good morning, everyone, and thank you for being here. My name is Amber Fritz. I'm the manager of Supervised Consumption Services with Rezo Access Network in Sudbury. We submitted our application to the province on August the 27th, 2021, and we're still waiting. We have had very little communication as to what the status of our application is. Due to the disproportionate effect that this crisis is having on our region, we assumed that we would get funding. The city graciously stepped in and funded us until December the 31st, 2023. So that funding ended, and by the grace of people being generous enough to donate, we've been operating on donations since January 1st of this year. That allows us very little job security for folks. That allows us very little consistency for folks that access services. Numerous staff have resigned because of lack of job security, which we cannot offer people. And recently we had to reduce our services because of lack of staff. So we are now only open Monday to Friday, 10 a.m. until 4 p.m. And this was the first weekend that we weren't offering services over the weekend. And that was already felt by community. So what effect would us closing down completely have if the effect was felt over the span of 2 days without us offering services? We are the only supervised consumption site in the district of Sudbury, Manitoulin. There is nowhere else for us to refer people to should we close down. And when people say to us, well, where am I supposed to go? We say, we don't know because we don't have another consumption site. What we will have, however, is unsupervised consumption sites, people that used to come here in a supervised, safe, helpful, compassionate environment will now be back on the street, in alleyways, in public washrooms. If you don't have supervised consumption sites, you're going to have unsupervised consumption sites. We all know that this crisis is getting worse. It is not getting better. We need services like supervised consumption sites more than ever to ensure that people who use drugs have the support that they need. There's a significant amount of inequity between the North and the South. Should Timmins and Sudbury shut down, there will be no supervised consumption services between Toronto and Thunder Bay. That's a pretty vast area if you think about it. So people who use drugs deserve better. People in Sudbury deserve better. All we want to do is support our community and keep people alive. And we know that supervised consumption sites do this. So I'm grateful that everyone came together today, and thank you for people that have taken the time to join us. This is an issue that needs more attention and that needs to be brought to the forefront because people are dying and people will continue to die if we don't have action on this issue.
Thank you, Amber. We will now take media questions. Just a reminder, if you're our media, please identify yourself in the chat or add your questions to the Q&A. You may raise your hand too, and we'll get you unmuted. Is there, Jessica, Beta, anyone specifically to ask first? There is a question in the Q&A from Nikki Cole at Barrie today. Nikki, would you like to ask that question? Okay, well, Nikki is asking about what does this pause or delay mean for Barrie's application for a supervised consumption site? We don't know. They submitted their application 28 months ago. So I would ask the provincial government that question. We don't know what that means. I don't know how much longer it takes to process an application. Next, we have Jenny Lamoth. Sorry if I'm getting the name wrong, from Sudbury. Did you have a question? Yes, Jenny. Can someone unmute Jenny, please?
Good afternoon. Can you hear me clearly?
Yes, we can. Thank you, Jenny.
I said afternoon like it's already afternoon. My name is Jenny Lamotte. I'm from Sudbury.com. My question is for either Dr. Sampson or for Amber Fritz. What I understand of supervised consumption sites, that as much as they are exactly what they are, a place to consume supervised, they are also offering significant amount of wraparound services. And those are services that are also disproportionately affecting Northern Ontario with inequality access to care. Can you speak a little bit more about some of those other services that supervised consumption sites are offering and what our city may lose without funding?
Would you like me to answer this one, Julie? Okay. So that's a really great point, Jenny. Thank you. That yes, absolutely, people come here to consume drugs, but that's one small component of what happens within these sites. We connect individuals with replacing their identification. We connect individuals with housing services. If someone identifies that they want to go to treatment for their substance use, we support them to navigate that process, which can be very confusing and very overwhelming for folks. The identification piece is really important, especially for unhoused individuals who quite often have their belongings stolen or lost. And without identification, that makes things so much more challenging. So if someone can be in an environment where they can totally be themselves, they don't have to pretend that they didn't just use drugs. They know that they're not in a judgmental place, and they can sit down with staff that they know that the staff here accept them for exactly who they are in that moment, and then can move forward with what else can I help you with? Okay, we've got your identification taken care of. What about your housing, primary care, dental work? You name it, anything. Oh, you don't have a pair of winter boots? Let's connect you with someone to bring you a pair of winter boots. I mean, anything that someone asks, we do our absolute best to assist them with.
Thank you. I appreciate your answer.
I just wanted to check back with Nikki Cole from Barrie if there was a follow-up question in response to the Barrie application.
Hi there. Sorry, I was having issues with the sound on this. No, I mean, you made a pretty good point. Is how long does it take to process an application? So I'm just curious for those on the panel, what does your gut say? Do you think that, if other sites are closing, will the site in Barrie ever happen? Do you think the government's just going to just close everything down and just sort of stall this out?
I don't know. All I know is that by June 2017, we had 20 sites up and running across the province that were funded provincially. We're down to 17 now, and not one new site has opened in the last 6 years. So again, we need pointed questions of the government, of the Minister of Health and the Associate Minister of Health and Mental Health and Addictions.
Thank you.
There's a question from Michael Brennan. Michelle from CTV Windsor, would you like to ask your question to Michael? Go ahead, Michelle.
Michael, can you hear me?
You can now.
Oh,
Can you hear me,
I
Michael?
can, Michelle. Yes.
Okay. So yeah, I'm just wondering. It's really freezing. Okay. I'll just say it real quick.
No problem.
Just wondering if there was some pushback by a counselor after SafePoint opened here. Do you think that is impacting the province's decision to delay making a decision about the future of SafePoint?
Yeah, so thank you, Michelle, for asking that question. And, I'm not sure how closely the municipality is following the province or the province is following the municipality. All I can say to that point is, as you're probably already aware, Michelle, we have gone to council on multiple occasions and presented council with all of the information around the development of the CTS. We continue to remain engaged with the city. The city continues to sit on our stakeholders committee. We're able to continue to keep them apprised of what's happening at CTS in real time. And further to that, Michelle, I do want to add that within the application process too, there is continuous community engagement that needs to happen with the community, with the neighborhood around the CTS, and reporting back to the province as well. So whether a particular councillor objects or supports the CTS, it remains a necessary health and social support in our community. Thank you, Michelle.
Thank you, Michael. Michelle. There's a question in the chat from Erica at CBC News Sudbury. Erica, would you like to ask that question? Okay. Oh, there you go. Erica, please go ahead. We can hear you.
You can hear me? Okay, perfect. Yeah, so in the letter here, you've asked the government to meet with you by March 13th and hopefully give funding by the end of this month. What are the next steps for you and for the panelists here? Should you not hear back from the government by the 13th and should they not grant funding to you? What's next going forward after this?
Well, I think if they don't grant funding, we know some of these sites will close. And we've heard the outcomes of that. We are asking that if you are members of the public, please contact your MPP, please contact the Minister of Mental Health, Associate Minister of Mental Health and Addictions, and ask them to support this, say that you support this. If you're part of an organization, we ask you to please keep spreading the word. We need to build up that public pressure. And I'll turn it over to anyone else on the panel to see if you have responses. Conscious of the time, we only have a couple minutes left. If there are other unanswered questions in the chat or in the Q&A, we can do a follow-up through an email follow-up. Either Michael, Amber, Michael Brennan, do you want to just respond?
I would just like to say, despite all of these barriers, including the delay in potential funding, we are continuing as a community to try and build these collaborative relationships as asked of us and forge new care pathways that support a more meaningful and comprehensive community response to these issues in our community. The challenge is always when you're trying to meet people where they're at with their substance use. A CTS created the ideal space for us to engage with folks. I'll leave it at that.
Okay. I really appreciate everyone coming today. There's a question last question from Paige Desmond from Kitchener. Paige, do you want to ask a question? Someone can unmute Paige. Go ahead, Paige.
Can you hear me all right?
Yes, we can.
All right. So Paige Desmond from the Record in Kitchener. Shout out to Michael Parkinson. My question is for Amber. And I apologize that it's an obvious question, but you said, community has already felt the impacts of the reduced hours of service. Can you speak a little bit more for people who maybe aren't familiar with CTS as to what those impacts are?
So we have folks that come here every day, multiple times a day, because this is where they feel safe. And this is where they know, should something go wrong with the unpredictable toxic supply, that we are here with highly trained staff to respond immediately. So folks are feeling anxious. They're feeling a little unsure on where to go, because this has become very much a part of people's daily routine. We feed folks. Sometimes this is the only place where someone has something to eat all day. So just having that sense where, okay, well, I'm not going to the spot today. Where am I going to go? It just reduces a place of safety and a place of consistency, which can start to break down trust. How come they're not open? And it's really heartbreaking to see, the facial expressions and the responses we get from folks when we tell them, it looks like, unless the province steps in, it looks like for real this time, we're going to shut down at the end of this month. And people just say, how can this place shut down? How is that even possible? Like, it's just mind-blowing that seeing all the beautiful work that happens here, like, how could it not be funded? So people are feeling a lot of anxiety over the span of 2 days. I can only imagine what the community response is going to be if we do fully shut down. It's really, really unfair. We have built an incredible community within this site. And it's absolutely heartbreaking, and it's infuriating, if I'm perfectly honest.
Thank you, Amber. We're at time. We will follow up. We'll try to follow up with any unanswered questions with an email follow-up. The recording of this will be posted online on YouTube. There has been a press release that's been sent out. If you are media and would like to arrange additional interviews, or you're not already on CDPC's media list to receive other press releases, please email Jessica directly at jhannon@sfu.ca. Again, thank you all so much for coming and your interest in this, and please keep the pressure on the government to respond in an effective and compassionate and fiscally responsible way. Thank you.
That was the update about the supervised consumption sites. Thank you for watching.